Welcome back to Creating Dementia Solutions. I'm Richard Pyatt. It's a Miles for Memories program. Miles for Memories in Calhoun County, focused on movement, programming, and research for folks living with dementia and those who are caring for them. Thanks for being with us on this program, whether you're seeing us on Access Vision or YouTube or hearing us at battlecreekpodcast.com perhaps, however you're finding us. We appreciate that. And if you have been finding us, particularly over the last year, you knew we were talking specifically to caregivers and trying to provide information that's helpful to them. One of the things we talked about in 2024 was the Lancet list, the list of ways in which we can reduce our potential for dementia. The Lancet expanded that list in 2024. Sherry Sherbin and I talked about that in a previous episode. This year, in 2025, we're going to focus on those things on that list and talk about them in a little bit more depth. And so, Steve Maloka is joining us today. He's an audiologist with Oak Lawn Hospital. One of the things on this list that helps us reduce our potential for dementia is hearing, and hearing well. Steve, welcome.
Thank you. Thanks for having me.
Well, we appreciate the insights that you'll provide for us today. You know, one of the things about hearing is recognizing that you're not hearing as well. How does that usually happen in your experience?
Well, generally, hearing loss is very gradual. So as you get older, you start to lose certain sounds. Primarily high frequencies. So it's a very gradual process, and a lot of people they don't notice it.
Yes.
Until they start to see some signs, such as having difficulty understanding speech and noise. That's usually one of the first symptoms that people will notice. But a lot of times other people, their family members will notice the hearing loss even before they do.
I can relate to that.
Yeah, so some of the reasons that people will struggle with clarity is because in those high frequencies, you have certain consonants. So sounds like S, F, TH, SH, PT, those are sounds in that range that people start to lose. So they can tell when people are talking to them, but they just struggle with clarity because they're missing parts of each word.
Mm-hmm. That makes sense. I can relate to that also, having been in broadcasting and wearing headphones most every single day.
Yeah.
I've noticed sometimes too, if someone's not facing me,
Exactly.
I may not catch everything they've said.
So that's what people with hearing loss will need to do. Just like you said, other senses will pick up the slack. Their vision, they'll look at the person's face, and that helps. They'll fill in some of the gaps that your ears are missing. Mm-hmm. It just takes a lot more energy to do that, and a lot more focus and attention. But when you're in background noise, that background noise is just very distracting. So you're not able to focus as much to fill in those gaps, so you'll struggle more in those situations.
Let's add the dementia component to this. So Lancet points out that being on top of or addressing a hearing loss situation can be helpful in terms of mitigating an onset of dementia in a lot of cases. Why is that? What is it about losing our hearing that could have an effect on a dementia situation?
Yeah, so research has shown that when your brain is not hearing certain sounds anymore, it can tend to atrophy, and then that can lead to dementia. But also, when you're not hearing all those sounds and the other senses have to pick up the slack, they have to work harder. So that could also lead to dementia as well too.
Right, so these factors are exactly what Lancet's talking about. If we try to mitigate these things, this will be helpful on a lot of levels,
Sure.
Obviously. So when you meet people, I presume some folks, and this was my experience with some of my relatives, they're not ready to acknowledge that this is happening. Is that common, and is that a complication?
I do see a pretty large range of the people that are ready and then those are not ready. I mean, we get some patients come in and they know they have the hearing loss. They're tired of having people repeat things and they're really ready to do something about it. I get others that their family is giving them that push, and they're not
Yes.
quite excited to start wearing hearing aids. Generally, for especially those type of patients, I like to do the hearing test. If we find that they have some hearing loss, it's really beneficial to put some hearing aids on them so they can hear the difference from this for themselves. Because hearing loss is so gradual, they just really don't know how much they lost until they get it back. And usually that's pretty eye-opening for them.
Wow. So, and we're going to talk about hearing aids more in our next episode too, so be prepared for that. But just generally speaking, you can test drive a hearing aid even if it's not meant for you exactly.
So there are different styles of hearing aids. We have demo hearing aids. They are the small behind the ear hearing aid.
I see.
Now, for most people, we can find domes, the part that fit in their ear, that fits their ear pretty well. And generally, those don't have to be custom made. So those are things that we can fit on the patient in the office. Now, they are programmed specifically for their hearing loss, though.
Okay.
Yep. So that way we can demo those right in the office.
All right. And so it's true then, they're getting a side-by-side, I suppose, comparison of what it's like to not hear well and hear better.
Correct. Yep. And sometimes just in the office, that's all they need to see. Other times, patients do better if we can just send them out for a week with a set of hearing aids so they can hear what it sounds like in their everyday living situations.
Yeah, interesting. All right. And as I say, we'll get into hearing aids a little bit more in the next episode. If someone comes to you for an audiology appointment, what happens? What can they expect?
Well, first of all, so at Oaklawn, we have ear, nose, and throat doctors. So a lot of times patients will see one of the doctors as well for the hearing test with Michael, and Michael's the other audiologist, and we test their hearing. You don't have to see the ENT. Sometimes patients will just ask their family doctor for a referral, and then they will just send them over for a hearing test. But either way, as long as we have an order, most insurance companies will cover a basic hearing test. Okay. But once they come in, we check their ear canal. Sometimes it could just be wax.
Oh.
And that's always kind of nice to see because there's an easy fix there. Just pull that wax out. But we make sure the ear canals are clear, and then we go through the testing to determine the level of hearing loss, what type of hearing loss it is. There are different kinds. Some possibly can be corrected. Most of it is sensory neural, which means there's really nothing you can do to fix it besides a hearing aid at that point.
Okay. So are you able to tell the kind of hearing loss it is just from a simple audiology screening?
Yep. Well, it's more than screening. It's a full exam, but yeah, so sometimes it could be, we call it conductive hearing loss. So if you have on the other side of the eardrum, you have a cavity. And what can happen there is fluid could fill up in that cavity like an ear infection and temporarily block the sound from getting to your inner ear. So you don't need a hearing aid at that point. You just need to have the ear, nose, and throat doctor look at that and figure out how to treat that. And once that fluid is out of there, either surgically or just with medication, that will restore the hearing.
Wow. So that kind of a situation has a level, dare I say, of simplicity to it in terms of the alternatives, I suppose. Interesting. So when they are seated for the hearing exam, I'm thinking about my days in school. I don't think I've had a hearing test since I was in school, but I remember wearing phones and they're playing different sounds to try and understand what level of hearing you have. Is it still that way?
It is. There are some different testing that we will do. One is called a tympanometer, where we put a probe in their ear and it measures the movement of the eardrum. But then we'll put headphones or earphones in their ears, and we're checking all those different speech frequencies and trying to find the threshold. Then we also do something called bone conduction, where it kind of goes behind the ear. That helps us determine if this is a conductive hearing loss or a sensory neural hearing loss.
All right, so this is perhaps more sophisticated than maybe the test I got in elementary school.
So those are screening, which are great. So we get kids in that failed hearing screenings in school. That's great. Well, now we can do all the diagnostic, full examination to determine how much hearing they really have. We have a soundproof booth to put them in as well, so we can control that.
All right, and that's a good point, that at that young age, there has to be some point at which just a general screening takes place in order for this to be recognized. A young person might not even realize they're not hearing.
Yeah, most of the time, hearing screenings are performed actually in the hospital at birth. A few days after birth, they can do testing now to determine if there potentially could be a hearing loss. Then beyond that, every student going into school, they'll need to pass a hearing screening at some point. Yep.
Okay. I suspect there are some folks listening who are caregivers, and if they're like me, I lived with my grandmother for a number of years, and those of us who are caregivers can recognize, as you said, some of that hearing loss sooner than they do.
Yeah.
That TV was loud.
Yeah.
And I'll tell you, she wasn't all that excited about the notion of really facing whatever the situation was there. If you're a caregiver and we're trying to encourage a loved one to have this kind of a screening, do you have any tips for us? How can we approach that subject?
Yeah, that's tough. The most success most people have will typically be if you can convince them to come in just to have a baseline done. Mm-hmm. Just start there. You know, here at Oaklawn, Michael and I are not ever pushing anything on patients. That they're not ready or they're not ready. Mm-hmm. But generally, if we can get them in there for a hearing screening or hearing examination, just to have a baseline, and then go from there. If we find that there's some hearing loss, we can kind of talk to them about that, explain why they're probably struggling a little bit. And then the next step would be to get them back in for a hearing aid evaluation to kind of demo some hearing aids so that they can hear the difference. But you can get them in there for just a baseline. That's a good starting point.
Well, and they say knowledge is power, right? So at the very least, they have some new knowledge about what their situation is, and they can do with it what they will.
Yep.
But of course, the quality of life, and there could be as well some health ramifications to making some corrective steps here.
For sure.
Are there any others? I mean, we're certainly focused on the dementia connection here, but does a loss of hearing affect us in other ways?
Yeah, a lot of times what happens is people tend to withdraw from social settings because it's just too hard for them to follow conversations, especially if there's any competing noise. They have to struggle, and it just comes to the point where it's too difficult, so they just stay home, and that's not good.
Before we were recording, we were discussing a great uncle of mine who was completely deaf in one ear and almost so in the other. And that certainly was true for him. He found it difficult to follow conversations, and so he might have been in a social situation with the family, but he was not participating in the conversation. This becomes tiresome for them. Yeah.
And it's hard on families too, caregivers as well. It's frustrating to have to repeat everything, and it causes tension for sure.
Sure. And I'm sure you've seen folks come in whose spouses or other family members have said, "It's time, let's go." And maybe another way to try and encourage that might be through the primary care doctor.
Oh, sure. Yeah.
They probably are in a position to be able to offer a authoritative kind of purview.
That happens as well too.
Yeah. Yeah, you need to have a test.
Yep.
Yeah. All right. Very interesting. Well, certainly the Lancet list, as we've discussed, is focusing on some of these ways that we can try and mitigate our risk for dementia. So if hearing loss, as we've pointed out, can have some corrective action taken, that could have some really significant ramifications. So perhaps if you're reading the captioning on this easier than you're hearing my voice, maybe that's a sign that a hearing test is in order. And at Oaklawn, as you pointed out, you're doing so on the main campus in Marshall, but you're also going to be doing so in Battle Creek, right?
Yeah, so right now at the Beckley Road building, it's a express care, but it also has medical offices there. Our ear, nose, and throat doctors have been going there, and now audiology services will be starting there in actually a few weeks. We got a new booth, equipment, everything's coming, so we'll have our main location in Marshall, right in the Wright Medical Building in Oaklawn, and then at the Beckley Road office.
Okay.
Yep.
So Steve will be ready to assist as needed. And I suppose you do have folks who call up and make their own appointments. They haven't been motivated by a doctor. They're ready to.
They're ready, and then we'll give them guidance on just, what if they just want to come in to see one of the ENTs, they order the hearing test, or if they just want to contact their family doctor and have them order it. Either way is fine.
Okay. Very good. Steve Maloka, audiologist, Oaklawn Hospital. Thank you.
Thank you.
As we mentioned, we'll be talking soon on Creating Dementia Solutions about hearing aids. So if you're curious about that, curious about affording them, all of those questions, that's coming up. In the meantime, we invite you to check out our episodes of Creating Dementia Solutions and follow Miles for Memories on Facebook. We'll alert you there when they are available. Take care.